Of contraceptives, this is actually a pretty good choice if you're looking for something that is going to have the smallest risk of causing blood clots. So, heart attack risk, I don't think that this is really valid. I mean, yes, there's probably going to be a person or a small number of individuals that they have an underlying, coagulation disorder, and they have a vascular event of sorts, but they're at a higher risk for that in any case. I think VTE, venous thromboembolism, is a much more realistic concern because there's a higher absolute risk of that.
Yeah, like a 45-year-old smoker with factor V and, FH.
I'm sure they'll just read the relative contraindications on the
package insert, get a magnifying glass and take a look.
Yeah. But I think, there will be a slight increase in a risk of coagulation and vascular events. But of contraceptives, this is actually a pretty good choice if you're looking for something that is going to have the smallest risk of causing blood clots. So honestly, the average woman is probably, if they go and buy this over the counter, they're going to have a lower risk medication from a blood clot standpoint than whatever pill they get from their primary or OBGYN. I was listening to a podcast about abnormal uterine bleeding. And I presume this woman working in the women's health field who was a physician was talking about, what pill you give for this. And she's like, really, any pill will get the job done, but we try to use one with lower estrogen. So you're going, that will control your abnormal uterine bleeding, but you're not looking at things outside of that, like blood clot risk.
Yeah, it's just like hormone replacement. And we say you can't be a hormone expert if you're not well-versed in every organ system in the body. So you can't just be well-versed in gynecology. You have to be a hematologist and hepatologist and neurologist to some degree, and at least be cognizant of the risks outside of that independent system. A pretty good rule of thumb, and there is plenty of clinical literature on this as well, is regardless of the strength of the estrogen or the amount of the estrogen, and regardless of the amount or the strength of the progestogen, from individual to individual, as you see platelets and SHBG rise, and this often happens when estrogens bind the estradiol alpha receptor in the liver. We do know that ethinyl estradiol is about 100 times stronger binding that than bioidentical estradiol. As you see those two rise, there is a very close association or correlation with risk of blood clot. So if your SHBG goes from 40 to 300, and then your platelets go from 150 to 500, regardless of what contraceptive you're on, that is a red flag, and you should be talking to your doctor about it. Or I guess if you just get this over the counter, you should be getting your own labs.
Labs are also over the counter.
They are.
Some people could probably do medical management of their own sort, although I don't recommend that. You should definitely talk to someone about your labs to make sure those are being interpreted appropriately. But it's kind of an interesting thought experiment. So it does give people something actionable to track, get a baseline and then see what kind of changes happen. Because then you can kind of extrapolate from that what the risks are going to be.